Hi everyone, my name is Ria and I'm going to be presenting on the potential of turmeric as a treatment for Alzheimer's disease. Before we jump into the presentation, I just wanted to quickly introduce myself. My name is Ria Medagam. I'm 16 years old and I'm from Downingtown, Pennsylvania. I'm also currently a rising senior at the Downingtown STEM Academy. A few of the extracurriculars I'm involved with include FBLA, which stands for Future Business Leaders of America. I'm currently my chapter's treasurer, and I've been a state and national level winner in my competitive events. I'm also part of an organization called IYNA, the International Youth Neuroscience Association, and I'm part of their Myelin team. Myelin is an initiative to create a global neuroscience curriculum for high schoolers, so I help create content for that. I also play tennis. I'm part of my school's academic team, and I'm a volunteer at my local hospital's ER. As for career plans, the two fields I'm most interested in right now are medicine and business, so I plan to either pursue a pre-med or business-related major in college. So this presentation will be looking at the potential of turmeric as a treatment for Alzheimer's. I became interested in this topic after meeting an Alzheimer's patient and seeing how it affected him firsthand while volunteering at my local hospital. So background, how is Alzheimer's a global health issue and why is it important? Alzheimer's is a neurodegenerative disorder and the leading cause of dementia among elderly people, contributing between 60 to 70% of all dementia cases. There is currently no treatment approved to halt or reverse the condition. Despite improvements in healthcare that mean people are living longer, there has been an increase in the number of people with Alzheimer's, making it a serious global health challenge. As you can see in this diagram, it currently affects more than 50 million people globally, and by 2050, over 100 million people are estimated to be affected. At the same time, global diagnosis rates remain low. As few as 1 in 10 individuals receives a diagnosis in low and middle income countries, and less than 50% are diagnosed in high income countries. The social and economic impact of Alzheimer's, not only on the people with it, but also on the carers, families, and society at large, makes Alzheimer's an important global health issue to address. Socially, there is a lack of awareness that Alzheimer's is a medical condition and not a normal part of aging. In a survey conducted by the Dementia Statistics Hub, they found that 40% of adults in the UK either incorrectly agreed with or were unsure of the statement, dementia is an inevitable part of getting older. In addition, 2 out of every 3 people globally believe there is little to no understanding of Alzheimer's in their country. This means that in many countries, those with Alzheimer's and their families face stigma, discrimination, barriers to care and diagnosis, and sometimes even violence. Economically, Alzheimer's is one of the most expensive diseases facing the developed world. Between now and 2050, the cost for care of people with Alzheimer's disease is expected to increase almost 5-fold, from $241 billion to over $1 trillion per year. Just to put that into perspective, the cost of Alzheimer's is expected to exceed the market value of some of the world's largest companies, including Apple, which is valued at $700 billion, and Google at close to $400 billion. Governments and communities need to come together to tackle Alzheimer's disease in order to ensure better diagnosis, higher standards of care, and increased awareness for those with Alzheimer's and also communities at large. So what is Alzheimer's? Understanding the causes and how it works. In those with Alzheimer's, neurons that store, process, and retrieve information progressively deteriorate and die. The damage usually starts in the part of the brain that controls memory before slowly spreading to other regions. By late stages of the disease, the brain shrinks significantly in size. While the exact causes of Alzheimer's are not yet fully understood, at its core, it appears to stem from problems with brain proteins. When brain proteins fail to function normally, they disrupt the work of neurons and cause them to lose communications with each other, eventually causing them to die. One of these proteins that researchers are focused on is beta amyloid. Beta amyloid is the protein fragment of the larger amyloid precursor protein, or APP. When these sticky fragments clump together, they form hard, insoluble deposits between neurons called amyloid plaques. When the plaques build up, they disrupt communications between neurons, activating immune cells, which triggers the immune response and eventually causes neurons to die. This theory that the accumulation and buildup of beta amyloid is what causes Alzheimer's is known as the amyloid hypothesis. Scientists have also found higher than normal concentrations of specific transition metal ions, including copper, iron, and zinc, in and around beta amyloid plaques. These ions bind to the plaques and increase accumulation. A study done by Ashley Bush and her team at the Harvard Medical School found that these ions release hydrogen peroxide as a byproduct, resulting in the formation of highly toxic reactive oxygen species, or ROS. The buildup of these species, which is known as oxidative stress and can be seen in the diagram, is harmful to the brain because it can damage lipids and DNA, it can modify biomolecules in the brain, and it can contribute to the loss of neural function, furthering the progression of Alzheimer's disease. So knowing this, how can turmeric be used as a treatment? Many studies done have explored the potential of using turmeric as a treatment for Alzheimer's disease. Turmeric is a common spice used in South Asian cuisines, and it's a traditional Indian herbal medicine. Many studies done have focused specifically on the role of curcumin, one of the main components of turmeric. Curcumin may be beneficial in treating Alzheimer's because it is a metal chelator. Chelators are chemicals that can bind and react with metal ions to form stable and water-soluble compounds. Curcumin can form complexes with a number of different metal ions, including copper and iron, two of the metal ions commonly found in beta amyloid plaques. This suggests that curcumin may be capable of lowering neurotoxicity in the brain by shutting down hydrogen peroxide production, which is associated with the metal ions, and preventing oxidative stress, which makes Alzheimer's disease worse. In addition to being a metal chelator, curcumin is also lipophilic, which means that it can easily dissolve in lipids or fats. So this means that curcumin is able to cross the blood-brain barrier, bind to plaques, and prevent accumulation. This can decrease the size of plaques and potentially even eliminate them altogether. A 2004 study conducted by Professor Yang and associates at UCLA found that mice that consumed a curcumin-based diet for 5 months had lower levels of amyloid plaque in their brain compared to their controls. They also concluded that curcumin helped decrease symptoms and help protect brain cells. Curcumin is also an antioxidant and anti-inflammatory substance, so it can suppress the inflammation of nerve cells and further combat the progression of the disease. These two images were taken from that 2004 study. On the left, the yellow indicates the turmeric binding to the plaques, and on the right, the graph shows how it inhibits the aggregation of beta amyloid plaque. So conclusion, what can be done in the future? The role of curcumin as a metal chelator, a lipophilic substance, and an antioxidant and anti-inflammatory substance makes turmeric a promising treatment for Alzheimer's disease. A number of studies, such as the ones I mentioned earlier, have used mice and cell models of Alzheimer's to show that curcumin could be beneficial. However, the few clinical studies done in humans, their results have been mixed, and some have not shown the same results as the studies in cell and mice. For example, a 24-week phase 2 clinical study conducted at UCLA found that curcumin C3 complex, a curcumin-based supplement, failed to generate cognitive improvements in 36 people with mild to moderate Alzheimer's disease. With evidence from lab studies suggesting that it could be beneficial, it is worth further exploring the effects of turmeric and curcumin to see if it could lead to potential treatments. Large-scale clinical studies need to be conducted on adults with Alzheimer's before definitive conclusions can be drawn. Currently, there are a few research studies being carried out looking at specifically the anti-inflammatory role of curcumin. Drugs that prevent oxidative stress like antioxidants and metal chelating agents are also being tested by scientists, which will hopefully provide more treatment options for those with Alzheimer's disease. Okay, so these are my citations. Acknowledgements. I'd like to thank my parents for helping me develop my presentation and listening to me practice many times. My teachers, Dr. Schwartz and Dr. Carrier, for their guidance and advice throughout the research process, and my friend Akruti for helping me edit my presentation. And quickly, before I end, I have my email listed. It's ria03m@gmail.com. If you guys have any questions, any thoughts or comments, please feel free to contact me. I'd be more than happy to chat with you guys. Thank you.